So we will start sharp at 4 o'clock. Before that, I would just like to provide you few guidelines. With all your permission, can I put them across, sir?
Yeah.
That before we commence the live session, I would like to request your cooperation for our quality assurance process. It is imperative that the framing of doctor's video meets our quality standards. Therefore, I kindly request you to maintain a stable position and ensure proper camera framing throughout the entire session. Additionally, please refrain from engaging in any other activities while the recording is being live. Furthermore, in the event of low network bandwidth, I recommend sharing the presentation from the laptop. Your adherence to these guidelines will greatly contribute to the overall quality and effectiveness of the recording. Thank you for your understanding and cooperation, sir.
Yeah.
So we will begin, sir, within 2 minutes, sir.
Okay, sure.
So, sir, are we good to start, sir? Sir, are we good to start, sir?
Yeah, sure,
Okay,
definitely.
sir. So, greetings and a warm welcome to everyone. I'm Shweta, the asset moderator from Karnit. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us across the country. We are indeed fortunate to have the valuable support of the esteemed doctors, and I express my gratitude to each one of you for dedicating your time with us on today's session. Allow me a moment to introduce our platform, LearnIt. It stands as one of the largest live digital CME platforms in India, providing space for doctors to create and share their medical content. Now, I would like to extend a special welcome to today's distinguished speaker, Dr. Niraj Pandit, sir. Sir holds a degree of MBBS, MD, AFIEH, Professor and Head Department of Community Medicine, SBKS Medical Institute and Research Center, Sumanta Vidyapeeth, Pipradia, Vadodara. Sir is going to enlighten us on a topic, Role of Telemedicine and Digital Technology in Public Health in India. Before going into the session, a brief overview of today's topic. In many parts of India, inadequate medical facilities remain a challenge. However, technology can help bridge this gap, especially in remote areas, by providing higher quality care at reduced cost. In many parts of India, inadequate medical facilities remain a challenge. However, technology can help bridge this gap, especially in remote areas by providing higher quality care at reduced cost. Telemedicine, the practice of remotely diagnosing and treating patients through communication networks, have been instrumental since the COVID-19 pandemic. So without taking any further time, sir, I would like to hand over the session to you, sir, for the talk. Over to you, sir. Kindly proceed with your.
Sure. Thank you. I'm just sharing this my PPT. Is it visible?
Yes, sir. Slideshow mode. Yes, sir, perfectly visible, sir.
Okay. So, good afternoon, and thank you, Clarnet, for the giving the opportunity. This is my last session in the series of telemedicine role in medical services. Okay, this is an interesting session. In this session, we will try to see the important aspect of the telemedicine, which is really practical for all of you. Okay, So begin with one case study. This is a case study from the Himachal Pradesh Telemedicine Project PPP with Apollo Hospital. It is already there on the website of the National Summit on the Best Practice in National Health Mission 2015. So this is the case of Mohit. This is a very interesting case of Mohit, that is resident of Sansa village, Lahul, that is a Spiti district. He is 49. He is a sole breadwinner in the family. Okay, so in this particular case, if you see, that is a very interesting part, that he has a chest pain and came to the hospital. He was about to refer to the Kullu Zonal Hospital as a case with the most of the patient with the acute chest pain. However, Chief Medical Officer thought of consulting tele-emergency doctor before referring the Mohit to the Kullu. Setup of the tele-emergency room was completed just a day before arrival of the patient. That's very interesting. He was really lucky. In less than 10 minutes, emergency interventionist was available over the tele-emergency system. He suggested the emergency nurse to connect the patient to the remote diagnostic kit to monitor patient's vital in real time. After initial assessment of the circulation, airway, breathing, ECG, CBG, he was diagnosed with the unstable angina. Pre-medications were administered as advised by the interventionist to stabilize the patient. After overnight monitoring, Mohit moved back home and was advised to take a specialist consultation with a cardiologist. Due to telepresence of the emergency interventionist and basic life support medicine, Mohit didn't travel all the way Kullu as a referral patient, saving precious time and exchange your money. Most importantly, 26th May renewed his faith in the district hospital. See, this is the strength of the telemedicine. You can just save a life. If the Mohit traveled from this particular village to the Kullu, it took a lot of time. And you know, Himachal Pradesh and this Uttarakhand, these are the area. It's very difficult to travel, and there is a very high chances of rain, and you can say landsliding, everything. In this scenario, this telemedicine saved the life. So this is the medical care services, how telemedicine can help. So this is a case report. I am just giving example. There are a few example more we will discuss. So today's session, we will talk about the medical care. We will try to understand medical care. What is medical care we are focusing? Current practice of the telemedicine in medical care. Scope opportunity with a few example, what is currently going on. And this we will discuss over next 20-25 minutes. So see, this is basically we are talking here in the medical care, emergency care. So here, everything keep aside, doctor-patient relation we are talking here in this telemedicine. The first time OPD care, when patient comes, usually our mentality, an Indian patient want, I would like to visit doctor's OPD. He will go to the consultation site, take a case paper and waiting room, and is seeing the patient in the OPD, seeing doctor in the OPD. So this is the first time OPD care. Everybody has a fixed mentality, fixed conditioning in their mind. Then follow-up, regular follow-up care. This is very interesting. Follow-up care is sometimes very difficult. It's a tedious, everything fine. Why should I go to the doctor? And it's a time wasting, it's a long waiting period. Then start the questions. First time they will love to meet the doctor. Second time onward, they may not be liked properly. Then emergency care. This is very important. I have quoted the example of the emergency care and how telemedicine can help in the emergency care. And emergency care, we always have to reach to the hospital. So this, where the easy reach area is there, you are in the urban area, facilities are available, emergency care, that is in the just, you can reach and get the emergency care. Optimization of the service. Now this is very important. You need to keep in mind cost, value, optimal solution analysis. And based on this, you can optimize what should be personalized care or telemedicine care. And this balance need to understand. So again, I insisting on understanding the model of the Himachal Pradesh, what they discuss in that particular slide. I am again presenting that slide with really thanks to the National Health Mission of the Himachal Pradesh. See what they have written. This is cost effective analysis. They need a cost, value, and optimal solution. And this is very important. Employing 6 specialist doctors in one hospital, direct cost to exchequer is 1.44 crore annually to the National Health Mission of the Himachal Pradesh. Okay, then you can see that tele-clinic and tele-emergency setup customized to need of the Himachal Pradesh is 1.08 crore, including all asset and services. This is 1 year cost 1.44 crore. It's a one-time cost 1.08 crore and linked with the, you can say, a expert hospital. See the value. At the lower cost, the telehealth project provide access to over 30 specialists and subspecialists for the OP consultants in all 7 days of week, 24/7 emergency support for stabilizing patient and community awareness. Very important. So this is the value. With this, a cost of 1.08 crore, and this is the 30 specialists and subspecialists, and all over the, you can say, a 2 district they have targeted, and they can have a 24/7 services. So PPP model of the telehealth service focusing on various aspects of the healthcare delivery that seamlessly integrated with the existing system. And this is the way they have set up 2 districts with the Apollo hospital, and then this communication model they are delivering, and that is true in the 2015. It was the pre-COVID era. Keep in mind, this is a very important way of cost, value, and optimum solution analysis for anywhere. So whether you should go for the telemedicine or not, you need to look into the matter with the help of such type of the analysis. Now, this is a telemedicine 2.0 Himachal Pradesh PPP model mod project. See, this is the 2 district they have connected, and they are really connected through the satellite, because in 2015 we don't have that much network, easy network. So remote health services beyond the teleconsultation and teleeducation, that's set by the Himachal Pradesh. Geographical remoteness, difficult access to specialist services. You know, Himachal Pradesh, you must have visited the various places of the Himachal Pradesh. It's really tough to travel, tough to reach, and emergency is next to impossible in the season like monsoon, and even in the season like winter. So here, what they are doing, the field team training, this is very important. Here you need to train field team and telemedicine instrument setup and use of the same in that particular training. Your spoke, they are saying hub and spoke concept. Spoke means a center where patient is coming for the emergency or the routine care. Here they are sitting and the patient is coming, and all the telemedicine instruments are there. They are using that instrument, connect this patient, all the vitals, all the blood investigation, everything through that instrument to the remotely available consultant specialist. And this required a training. So infrastructure development and training, and with also doctor who are sitting at the remote place, we need to train them also about how to take care of the reports and counsel the patient. So this is a real telemedicine. Okay, this required a 2 important part, that is a spoke, that means center, you can say a hub, and hub where the doctor is sitting, consultant is sitting. So this model, and that is particularly, you can say, with the help of satellite, they are connected. So this was the in 2015. Now people are using not only satellite, but using the mobile tower for the telemedicine. So this is the model we need to keep in mind. There are other models here I would like to discuss, which was currently developed by the different people. And that is particularly a medical care and the telemedicine healthcare on wheel by the Tata Trust. Tata Trust have come up with a comprehensive solution by introducing the telemedicine services. 20 telemedicine centers, 1 doctor's hub, and 1 diagnostic laboratory to provide a quality primary health care services to the 10 lakh population in rural Krishna district. See, this is very interesting. 10 lakh population, 20 telemedicine centers, 1 doctor hub, and 1 diagnostic laboratory provide the quality primary healthcare services. Okay, so in primary healthcare, you can see that's little bit easy. In Gujarat, what we did, many places in the Gujarat, they have given a PHC center a telemedicine instruments. And they're trying to set up this instrument and they're trying to connect with the specialist. So whenever they require the support of the doctor, they connect this instrument to the doctor and they're providing. Okay, so here the concept of the doctor's hub and the POC, that center, that is very important way you need to develop, and you need to connect them and connect, because see, this is very important. Your peripheral centers may be mobile medical unit. That Tata did an exercise with the mobile medical unit equipped with an acoustic portable lab and Trinetra for the ophthalmic screening, reaches out to the remote villages to conduct the OPD clinics. See, this is the website. You will get a more detail about their stories and all the things. Glow Hill is that basically a concept of the Tata, and Tata Trust has funded this for the district Krishna. So see how this stethoscope and everything, they are connected. You can see the doctor sitting on the screen. The lady is just putting a stethoscope here. This stethoscope is connected through this particular instrument to the doctor, and doctor is listening, not that lady is listening. So this is very important. You need to keep in mind. She is just putting a stethoscope, but audible to the doctor. So ECG, blood report, everything they are connecting of this patient to the remote doctor as a reference. So this is very important, and doctor is giving the prescription also, e-prescription, that's coming to the here, and they are providing drugs. So this medical care use in telemedicine, this is one of the, after Himachal Pradesh story, this is a Tata Trust story, which is particularly for the Krishna district of the Maharashtra, and they have this particular experience. So this is a second example I am giving. Third and largest example, I think, hope you all have heard about this E-Sanjivani. E-Sanjivani is a national telemedicine service of India. Bharat is a step towards the digital health equity to achieve the universal health coverage. Free telemedicine consultation. See, this is a very interesting website. If you get a time, visit the E-Sanjivani. If you are a doctor, if you want to do some social services, you can connect with the E-Sanjivani. And E-Sanjivani is giving opportunity to every doctor to join them for their E-Sanjivani OPD. But you have to provide a free services. It is a government platform, is provided by the government. And see, the very interesting till date, I have just reported today morning only, that is of, you can say 26th April today, and 223.5 crore patient took benefits of these services. This is very simple service. You can say a consultation service, a patient to doctor direct and assisted medicine, telemedicine. So patient to doctor means those patients who are learned, who can able to handle the things, who can able to handle the OPD, they can directly register, log in on the E-Sanjivani, book the consultation, enter the OPD, consult the doctor, and get the prescription. See, it's a very simple. You can connect your doctor through the mobile only, and you will get a e-prescription. Here, there are limitations. It is not like completely the model like this. Here you are sitting somewhere, anywhere. So at your home also, in this particular patient to doctor telemedicine, you are at home also. So you need to produce your reports. You need to give your proper history. Based on the history and report, doctor try to diagnose. Doctor may require to get some investigation. He may suggest the investigation. You will may connect to nearby blood laboratory center, laboratory exam or X-ray, and get the report, and again contact to the doctor. Doctor will get the diagnosis and prescription. So here is direct patient to doctor. Second is, you can have a second, next tab is assisted telemedicine, because few people do not know how to handle the mobile. So they will reach to the telemedicine center. That may be a health and wellness center. You can say Arogya Mandir of the sub-center, PHC or anywhere. They will go to that. where the person is sitting, the health and wellness consultant are there. They are sitting there. They are opening the OPD, this web page of this E-Sanjivani OPD, register. They put their login ID, put yourself as a patient, and this is the thing. Enter in the OPD, then again the same way, enter into the OPD, reaching to the consultation and getting whatever the instruction and getting back to you. So this is the way you can consult E-Sanjivani. And this is a very interesting concept. Government of India initiative during the COVID time, and a huge successful project going on until it is going in. There are a lot of doctors who have visited 1,000, 10,000, 15,000 patients till date. So they are really doing a good job. Government doctors also doing the good job. So each Sanjeevani is really a most important component of telemedicine in India currently going on. Next. This is a very interesting concept of virtual counseling of mental health issue. This Minds Foundation, India, I am also connected with this particular organization. Since inception, they have started work in India, in Vadodara particularly since 2011. We have started this services of mission is committed to eliminate the stigma surrounding the mental illness through the education, training, providing access to cost-effective, high-quality care. So this is the mission. They want to eliminate this stigma surrounding the mental illness. They did a really good job. I'm still connected. They are still doing a good job. Chota Udaipur is the area where the tribal district is there. They are working there also. Vadodara also they are working. They are working in the Bhavnagar district also. And now they expanded through services to Mumbai also and in the South India also. So you can visit the website of the Minds Foundation. What they have started? They have started a virtual counseling services. And this you need to understand. If anybody interested, this is a model. This is actually a self-sufficient model. It is not a free model. So they have made a website and put everything. You can see the free initial consultation will provide you with the opportunity to ask the question, learn about our services, and decide if you think we are right therapy platform for you, we will assess. So you can book a first consultation is free. You have to put all the details, and within 48 hours, they will connect to you. So they will contact you. And once contact, you can take one of the package and you have to pay the packages and services are provided online. Okay, so there are experts sitting. You will get all detail about the experts who are going to provide the services, what are their skill, everything. And this is the way NGO giving the consultancy charges and consultancy services in the counseling, mental health. They are charging around 250 rupees to 500 rupees per sitting maybe a 30 minutes to the 1 hour. So depending on they are charging. You can visit the website of the Minds Foundation. You will get more information. So they provide the services at the low cost, but very interesting. So you need to keep in mind this model of the Mind Foundation also very important. Now the paid, like subsidized, this is a paid model. You can see there are certain models available, paid telemedicine models. Doc Jenny. Doc Jenny is very interesting online consultation platform for the patient where they are charging fees from the 1,200 rupees to 400 rupees per consultation. And these things are there. They are also providing with the 4,200 rupees personalized guidance and support for the mental well-being, elderly healthcare, 8,000 rupees proactive comprehensive care of the elderly, post-COVID rehabilitation, 5,950 rupees, 15-day package, health recovery of the post-COVID, single patient package, 5,000. This all information available on the, I have took from the website only. So Doc Jenny website, they are paid consultancy. They also started same during time of the COVID pandemic. And consultant, they are charging the amount all over the India. They are providing services. They have written the doctor's profile. Doctor can talk in Hindi or English. And depending on, you can take a book appointment and take the, even you can book a lab test, plan, obesity treatment. These are the different models they are available for the dog journey. Very interesting model. You think over this part, how you can join. They have their own team. I don't know whether they are recruiting a new doctor in that team or not. What is the procedure? You need to contact them. Currently I have no direct contact with them, those people. I have just information taken from the website and put here. Once I get, I can evaluate this detail and put a one more video on one particular company, how they are working, what is the working model, what is the income expenditure, and what are the actually profit model for this. I may think to develop in the future. But keep in mind, this is the one more dog journey model of the telemedicine. Click to cure. This is our Vadodara based model. You can see it's a one-stop solution for the doctor. It is not purely a telemedicine, but a one-stop solution for doctors' growth journey to increase their patient footfall by 3x to 4x. They are giving you an opportunity, automation practice, remarketing, retargeting strategies specially designed for the doctors. So you can visit the website of the Click to Cure, and the lady who is taking care of this particular, she is trying very hard, the team is providing support to the doctor. They are giving the page. They are in under services. You can see, you can avail the different services. They're helping the doctor, but it is not purely a telemedicine. So you can keep in mind there's such type of the not pure telemedicine, but online doctor system is upcoming in India gradually, but still very few. I have a very limited such type of the model I can able to get when I search about the telemedicine issue. So keep in mind there is a huge opportunity. Okay, and difficult area. See, it's a very challenging part is that how to reach poor and difficult area part that we need to develop. Government is trying very hard, and wherever this problem is there, they are living in difficult area, remote area, and they have limited money. How to develop this particular model so you can earn the money? That is very challenging in case of the telemedicine. So this is one more click to cure. Scope of telemedicine in medical care. So now we will see what are the scope. Currently, only government medical services have a large scope in area of the telemedicine like E-Sanjivani and Himachal Pradesh PPP model. You can say all government, even government of Rajasthan, government of Orissa, Chhattisgarh, Maharashtra, they all government trying to be implement telemedicine through various agencies. Like Himachal Pradesh tried through the Apollo Hospital. There are some other agencies. They are partnering with the state government like Maharashtra, Rajasthan, Chhattisgarh, and this helping them to implement this telemedicine in difficult area where it is very difficult to reach. Okay, so difficult, remote, poor citizen of the country. So this is the important part. They are trying to build. See, internationally, you can see African country also telemedicine is very popular. Lot of work going on in the telemedicine because those countries also have a difficult remote area. So reaching to this population, their government is spending the money behind. For the private setup, limited private setup are popular looking to the cost and feasibility. So they are partnering with the government. Their own investment is very limited. But we need to keep in mind how to make a model profitable. In future, we can think on this point. This is very important aspect, medical colleges. See, there are 700 plus medical colleges in India and big corporate hospital. They can have something like social responsibility. Like corporate social responsibility, this is an institutional social responsibility. They can think how to make our doctors to provide services to the remote, difficult area. If someone is investing for the instrument, like a corporate social responsibility point of view, if some company invest and provide this basic instrument for the telemedicines to the medical colleges, and that is a doctor hub, and they developed a spoke at the periphery, and this is model can be a very good for the remote area like tribal and difficult to reach area. See, which are the services can be very easy with the telemedicine? See, follow-up care like geriatric medicine. Once a geriatric patient is on service, I think on treatment, he needed just follow few question, report of the few blood investigation, maybe sometime the X-ray. In this case, if your spoke is able to provide this blood investigation and X-ray services connected to the hospital, like medical college, no need to reach up to the uh, urban area. It's a really wasting of time, money, because geriatric people moving from villages to the urban area, it's a tough task. And doctor availability is also challenging. So the telemedicine in geriatric care is really a big opportunity. And upcoming, we can go ahead with this post-cancer care. Cancer patient after treatment follow-up care is very important. You can take this post-cancer care with the help of the telemedicine. Rehabilitation, stroke patient, post-operative, post-surgery, you can take this rehabilitation care through the telemedicine. ENC follow-up, except USG, few blood investigation, special investigation, no need to a ANC reach to the hospital. So this can be through a telemedicine. Vaccination at doorstep. There are few people who have started providing the vaccination through the doorstep with the help of the mobile app and other thing. So you can try this also, a vaccination at doorstep, like many cares you can convert to the telehealth care. So these are the scope opportunity for the telemedicine. See, I have just tried to be recollect the things with the help of the joining telemedicine. If the audience listening about here since 2 lecture and they want that available network, what I can do. So available network, they can join with government setup that is free, no additional income. You can provide the services to the government setup. Second, there are other things available. Pharma, Easy, Practo, Tata 1mg, Express Clinic, MediPlus, etc. Do they really telemedicine? That this all are providing some services, but they are really telemedicine, need to be think over, and that is also very important challenge. New setup, if you want to start your own services, develop your own platform with the own support, but required a good investment. So new setup is really challenging, and earning model is again a challenging. Generating money is challenging part, but follow up, as I said, geriatric care medicine, rehabilitation care medicine, you can say these are the things where you can start to think about the earning model. There are many international people are providing services. If you see the healthonomics, you write in the wage healthonomics, one of the website in the Ilios, US, they are providing the primary care through the telemedicine. That's very interesting model I came across recently. You can see that there are people trying, they are trying. We need to also do this try and set up something on this telemedicine. And last important slide is very important, that is challenging and threats. Whenever you are using barrier for the telemedicine, always keep in mind confidentiality, first and foremost. Complexity, it is not a one-person task. You need a team. Cases of misdiagnosis, chances, because here patient one-to-one, but here patient is not one-to-one. In telemedicine, patient sitting remotely. Controlled substance, there are many drugs which are not openly available, required a specific doctor's prescription. So controlled substance, fraud and abuse. You have recently read a lot about the fraud, online fraud. In case that can be happen, we need to be cautious, need to be take a legal aspect on the mind. Medical liability, data accuracy, patient privacy. These are the area which are a really threat, you can say a barrier, and they are the challenges we need to overcome when we implement the telemedicine. So, dear friends, it's simple but not that easy to establish a telemedicine setup and provide a services. But we can try, we can modify, you can increase your footfall at the level of the community. Because see, currently it's a huge heat is going on. It's very difficult for people to reach the hospital. It is the best way to do the online consultancy. If not emergency, if emergency, they can reach to the hub, and hub will help to the POC center and help the doctors out. So you can take this opportunity. So opportunities are there. Without hesitating, you can try. You can once try E-Sanjivani, register yourself in the E-Sanjivani, see how E-Sanjivani is working for you and how you can provide the services to the community. Do some social service, learn the telemedicine, and then think over how to start the things. Okay, with this, I really thank you to all of you. Anybody has a question, query, you can write the mail. My mail ID is here, and I really learned a lot through these sessions. I am thankful to the Clarinet for giving the opportunity, and I hope that in future also I will make more sessions for the you people. Thank you. All the best. Any question or query?